Behind the scenes, how American NGOs drive major medical impact. Anna Yabluchanska from United Health Ukraine is moderating. Marina Badyuk, PhD from United Health Ukraine, Alex Malikova, Razom, Katerina Kovalenko, Nova Ukraine, Olha Mahutyak, GMK, and I'm also on the panel, Taras Michlai.
You guys don't have slides. We don't have slides. Okay. Let me pull up then our header slide so we don't see ourselves. Sure. Good afternoon once again. United Help Ukraine, and I'm honored to welcome you to our panel today. It's called Behind the Scenes, How American NGOs Drive Major Medical Impacts. Over the next minutes, we will look on how American NGOs are making a real difference in Ukraine's healthcare system, not just through aid, but through coordination, strong partnerships, and compliance. I'm happy to introduce our speakers today from United Help Ukraine, Nova Ukraine, GMKA, Cleveland Maidan, and Razom, who will share how their projects are saving lives, strengthening hospitals, and building long-term capacity. To start, I would ask each of the panelists briefly introduce themselves before we start. Thank you.
And I'll start. Marina Badyuk. I'm the president and executive director of United Help Ukraine. I've been with this organization since 2014, first as a volunteer, then a board member, then the president and executive director. And it is my privilege to say hello to all of you. It's been a productive day. I know we're ready to go to the reception, so we'll try to make it a bit dynamic and active. I know there was a lot of very valuable information that you received with our wonderful doctors, but I think this panel is, we're really hoping for your participation and asking questions, and this is what it's all about, cooperation. Thank you.
Good evening, everybody. My name is Olga Mahuriak, and I'm the Chief Operating Officer for an organization called GMKA, Global Medical Knowledge Alliance, and I've been with the organization for about 2.5 months now. It is a pleasure to be here and be a part of this important panel.
Thank you, Oля. My name is Katerina Kovalenko, and I'm a Vice President for Strategic Alliances at Nova Ukraine. I joined Nova Ukraine 4 years ago almost, since the full-scale invasion. Before, I've been in business, in tech, in Microsoft, and so partnership, it's everything about my not only passion here, but also a background, so we will be happy to unpack this topic today. And I would like to say a separate thank you to all of you, because the day is long, and I feel a big respect being today with you. As a person born in the family of doctors, I know what's behind that. So thank you for being here. And I think the panel looks like something symbolic, because before a networking and partnership event in the evening, that's a good chance to make a light transition to evening reception. Thank you.
Good evening. Taras Michlai, internist, was an internist for University Hospitals of Cleveland for over 30 years, going back to Ukraine, doing different volunteering. I am now the president of the Cleveland Maidan Association, probably the smallest or an unknown organization that's sitting at this panel. They started in 2014, but in 22, we really converted to medical humanitarian aid, and you'll hear about one of our projects.
Hello, everyone. Thank you for being here, really. The fact that you made it through to now is amazing. So I'm Alex Malkova. I'm with Razom. I'm the Logistics and Supply Chain Manager. And I help bring in kind and supplies to Ukraine. And I just want to say Razum is not just about health. We actually have 5 programs where we not only support the healthcare system in Ukraine, but we also advocate for Ukrainian causes in Washington, D.C. We support small nonprofits in Ukraine with grants. We bring Ukrainian culture to U.S., and we also support frontline medics. So we do quite a lot, and I'm excited to be here to talk about some of our projects.
Thank you for introductions. I would like to start with small examples. Can each of you share one project your organization has implemented in Ukraine healthcare system and why you consider it to be success?
I guess I can start again. United Help Ukraine has always been very much of akin to work with partners, and we have so many partners here, partners there, and I think this is one of the strengths all of our organizations rely on, and actually today is one of those examples. We have so many professionals. This is something that started at Med Global Conference a year ago with a quick conversation with Nova and Razum about how we should have a conference just with sharing Ukrainian experience. This is what we have now, a wonderful conference with over 100 people sharing their experiences about Ukraine. But I want to go back to 2022 when we started majorly helping in Ukraine, when we started with logistics. We opened our very first warehouse in March of 2022 in Lviv, just a couple of weeks after the war started, with sending massive supplies of medical aid. I think that was one of the priorities for us. But we also quickly understood that with now over $86 million in supplies that went to Ukraine for defenders, humanitarian sector, and majorly to medical establishments, what we quickly also realized, as we all share today, that Ukraine really needed building capacity and also the training in so many various areas. And one of the areas that we also saw a need was for the hospitals to be prepared for massive casualty events. We've talked to some of the doctors, especially sort of reflecting on what happened in Kramatorsk when there was a massive, at the beginning of war, there was a massive bombing of the train station with 160 plus patients arriving at the hospital at the same time. And that hospital wasn't ready to accept those patients. And it wasn't ready just because of the training of the doctors, but majorly because there were no supplies, no triaging protocol, no understanding for staff of what to do when such event occurs. So back in 2022, we started this conversation with a couple of doctors in Ukraine and also the American organization, Syrian American Medical Association, SAMS, or Syrian American Medical Society, SAMS, which was based in Washington, D.C. They already went through quite a bit in Syria, and they said, well, we have a common aggressor. Syria was heavily bombed by Russians, and so they were eager to help us. And we started a project where Revived Future for Ukraine, Revival Institute for Future in Ukraine went as a partner. It's a Ukrainian medical association that was ready to implement a project of several organizations, including United Help Ukraine. We called it back in 2022. We called it Project 2022. Project 22, it was called Project 22, not because of the year 2022, but because we identified 22 hospitals in prefrontal area, which we thought would be there would be great candidates, unfortunately, for receiving mass casualties. And so this is how we started with Project 22, Syrian Association, United Help Ukraine, and the Ukrainian entity. And this project went very quickly from 22 hospitals to 63. And the protocol that we implemented was to have, we had a lot of in-person sessions, and we also had a lot of supervision and a lot of dialogue online. But the major point was to have the entire team from the hospital understand who is doing what and when. And this training really was implemented through 63 hospitals, and they would go back to us saying that it was a great project. We now understand how to triage patients. Of course, it's also 3 years of experience, but back then in 2022, it was important for them to come to those training sessions, get the knowledge from professionals. We also worked, we got the support from IOM, we got the support from WHO. So this project that started just with conversation ended up being a multifunctional, multi-organization, large project that supported 63 hospitals in Ukraine with the knowledge that they needed for the team that went from the manager of the supplies to the nurses, to the doctors, to the head of the hospital. And I remember there was one session in Kyiv, in-person session, where there was a chief, one of the heads of the hospitals in Kharkiv. And he said, he came to the session saying, what is it that you can teach us? In Kharkiv, we've seen everything. We've had those mass casualty events. We've had massive influx of patients. What is it that you can, what can we learn from you? And at the end, of course, he said, well, I've learned a lot, and I know now how to restructure internal structure of the hospital to really make sure that the triaging, the protocol, the supplies, everything is met, and we're ready for those events.
Thank you, Marina. Oля.
Thank you. Marina, since you kind of ended with educational piece, it just makes sense for me to talk about GMKA and what our organization does. So GMKA is a nonprofit that's registered in the United States and also in Ukraine, and we're really focused on bringing that clinical educational expertise to Ukraine through quality and safety, through building centers of excellence. And when I talk about centers of excellence, I don't mean building an actual building. I mean bringing expertise to already existing hospitals and centers that are in Ukraine. And that was something that was mentioned earlier today. And our focus for centers of excellence is in ATLS, nursing, neurology, breast cancer, oncology. But with the full-scale invasion, what GMKA did differently from everybody else was close educational gaps that were missing in Ukraine at that time. And what we've done, we actually translated deployed medicine protocols with partners such as Dr. Nesterenko and AUMF. We also conducted a WHO cancer needs assessment, and this will truly influence EU financing of Ukrainian oncology care moving years forward. And then also we implemented quality and safety protocols in 6 different hospitals. And I'm proud to share that as of now, we have 1,000 clinical cases that have information on post-operative infections complications, and this is going to be used for statistical processing and analysis. GMKA has also translated more than 30 different protocols, international protocols and algorithms and guidelines into Ukrainian, making them available across our educational platforms. And actually one of them was mentioned earlier today, which is Heal UA app. And during earlier presentations, we heard how important and how critical educational piece is for Ukrainian physicians and for that change in Ukrainian healthcare. And ATLS was mentioned as one of the priorities for years moving forward. And as of right now, our organization is already in process of translating ATLS version 11, and we're hoping to start, we're planning to start courses as soon as spring of 2026. And we actually have our one of our partners here, Nash Format, that's also helping us translate and print the books for ATLS 11. Thank you very much.
Thank you.
For us at Nova Ukraine, for me it was very difficult to choose one example because 120+ million spent for these 3.5 years in supporting healthcare and medical system. But I probably will start with that. Our operational model is built on partnership. Since the full-scale invasion started, we understood that we, working as a non-profit, we do not have enough capacity locally here in the US and on the ground in Ukraine to support and to deliver these huge scalable initiatives and to cover different hospitals, regions, traumas, whatever. So our approach was to find the best partners and those experts in the field here in the US, to find those doctors, clinics, local nonprofits working in medical system and medical and healthcare system and social system for a very long time, and try to combine our efforts around something. So as one of the example, and we had that a lot at the beginning of the full-scale invasion, it was everything about in-kind donation. You know that in Ukraine we lack of everything, like medical expenditures, equipment, and one of the example was our partnership with Med Global, when we had our own logistics system already built for a couple of months, warehouses, distribution, understanding and database of all hospitals in Ukraine. So that was really great partnership when the organization who works here and has and understand how to provide and what's needed on the market, and for us as a logistic partner. We had a partnership with a lot Ukrainian organizations like Patients of Ukraine, like Zdarovye. These are Leleka. These are huge local medical organizations that absolutely better know what's happening on the market, but they need some support or enhancement in materials, in budgets, in connections, in additional resources, whatever. And when we're talking about partnerships and when we are talking examples, successful examples of projects, I can say that the first type of projects was around providing required materials and equipment to Ukraine. And combining different organizations, we could share our resources and, of course, decrease our administrative costs significantly and make sure that all this money that we raise here working with donors are delivered directly to Ukraine, to hospitals. One of the projects probably that I would like to mention, and we will talk about that very deeply tomorrow, is Ukraine Without Borders. This project was born in 2023 at the end of the year, when we understood that in Ukraine there is no practical approach for chronic trauma healing. A lot of people suffered different types of injuries and they had prosthetics, but no protocols, and we had only several doctors who had this expertise. And we connected with Ministry of Healthcare just to understand what's happening and what are ideas and what are practices and what are protocols and agenda around this topic. And we understood that this is a huge gap on the market. And we as a nonprofit decided to take a leadership and to think what we can do. We had resources, we had budgets, we had donors, and we had a network of different partners. So we started to work first with Ukrainian doctors, and you will see them tomorrow. That's amazing and really very talented doctors, and they have definitely a lot of information to share with the world. And I'm sure that this knowledge will be practical and very useful for doctors for different countries, not only for those countries suffering or being in the crisis. From the other side, we understood that to provide the access to chronic pain healing, we need to open centers. So 1-2 centers are not enough in Ukraine. So we started to open those centers and created like a framework and model of those pain centers on the base of Feofania in Kyiv. And of course, together with those doctors, understanding what's needed. And the third direction, and I'm so grateful, Andrei, who's here from Doctors United from Ukraine, we have received one email as a reaction. I think it was like in some news article about this idea of opening pain centers. And then Rangers messaged, emailed to us and said, hey guys, interesting topic, let's think what we can do together. So because we have research, we have data, we understand like different approaches, what can be done, and we can provide you doctors, local doctors with additional knowledge. So this is how this project like extended. And for the moment, why it's like too early probably to say that it's like ended, but there's a lot of work to be done. But for the moment, it has like 3 pillars that cover first its doctors' trainings. So, and just a week ago, observership have added here at Yale Medical School, and Doctors United for Ukraine organized all this observership for Ukrainian doctors, and 6 doctors will come back to Ukraine, bringing this knowledge to university, to students, to other doctors in regions. So the first pillar is about education. So we understand that we need to bring knowledge to Ukrainian doctors. The other one is opening centers in smaller regions. For the moment, we have only 2 in Vinnytsia and Feofania, but we have plans to open and have a big ambition to have that in every region, especially in smaller towns. And we provide this innovative equipment to give access to those people who need this treatment. And the third direction of this project is research. Of course, a lot of information can be identified, and a lot information available already in the West, but practical information, and Ukraine can be a great lab for doctors to understand how it works and bring this knowledge and think how different like inventions can be born on these practical skills. So this is like one of the type of the project like that we see as an effective, because and where non-profit organizations, in our case like Nova Ukraine, just became a hub to connect, to find people, organizations in Ukraine, in America, around one big purpose.
Thank you, Katerina. Very impressive.
Yeah, our success story is probably a little bit easier to pick. It was a small project which has turned into a gigantic project. We usually ship just medical supplies to hospitals on the eastern, southern, or Sumy or Kharkiv. Anyway, the successful project was a medic training program. So me and the partners decided that our mission was started in the spring of 2023. It was to retrain medics who are already on the front with the latest NATO protocols, and also be ready to modify the protocols. Then in the summer of 2023, we were meeting with the Medical Corps and the Ukrainian Military Medical Academy weekly. We were having like 2-hour meetings every Tuesday. We decided the protocols, the needs, the supplies, and it came out to that we raised over $2 million for this project, and we purchased the material, we packed the material, and shipped it. Our first 18 training sets were shipped in April, and then our warehouse is in Zolochiv. And we picked a day, we came and we monitored from all the bases. There were 10 bases where they came and they picked up, and in that day, we distributed all the we called them supersets because we gave them more than what they wanted, and that's a different problem that we can talk about later. And then again, our second shipment was in August, where we shipped 14 more sets. Success story. We had that. Was it Alexander Lovchansky? Verify the numbers. So the number that I'm getting is that by the end of this year, we're supposed to be doing 27,000 medics of retraining. That is unverified. But who are we training? The Ukrainian Army, the National Guard, Air Force, Navy, Border Guards, and HUR. We are focused on TCC training tier 3 and 4. We do 94 skills. We train for 8 weeks, 10 hours a day, every day at the base. They do not leave that place. Also, with each training set, they get an SUV and a trailer. We implement this all in 2024. We went back to our donors, and what happened? We raised another $100,000 to have this program sustained for 2026. We raised $884,000, and we already bought and sent 92 quad bikes with casualty trailers provided. We provided them for that. And we raised another $250,000 from these donors to buy electrocoagulation devices for 6 forward hospitals, another $250,000 for surgical retractors for these medical facilities. Then we had another grandiose plan of building 20 medic training center modules. We raised $800,000. We already built 7 modules. This is for training and for housing, heated, because they were getting trained in the cold tents. And so we built 6 of them already in Rivno and Desna. And all I got to say is, we have this excellent team both on the U.S. and the Ukraine side. And trust, consistency, and a good team. Thanks.
Okay. I've been hearing a lot of talk about education, training, and I'm going to continue with that theme because I want to talk about Copilot. I'm sure a lot of you have heard of it, but for those who don't, this is our, I would say, premier project within ROSM. So we send North American doctors and nurses to Ukraine to perform surgeries in orthopedics, neurovascular, and facial reconstruction with their Ukrainian counterparts. So essentially, the Ukrainian and the North American doctors and nurses are working side by side for a week at a time and thus co-piloting with each other. The goal is to increase the knowledge of the Ukrainian doctors by allowing them to actively work and apply new techniques from their American and Canadian doctor colleagues. And this has been, I think, I've seen it from my perspective as a logistics manager, but I think there's been a lot of incredible outcomes that I've seen from this. And I think what makes it really successful is not only that we're helping a lot of patients. I think at this point, we've been running this program since 2016. We've helped hundreds of patients since then. We've visited a number of hospitals. We've had many surgeries. And I think really important is the partnerships that I've been seeing, the collaboration between the Ukrainian and the North American teams that are going beyond these missions. They're continuing to do research together. They're continuing to work together for training, for collaboration. So I think seeing these partnerships establish even after the co-pilot missions has been incredible. But it's not just that. We've seen clearly improved skills on not just the Ukrainian side, and we've seen Ukrainian doctors get significantly better in their techniques and their work, but also on the North American side. So a lot of doctors who go to Ukraine also learn from Ukrainians because, frankly, they just don't have the chance to practice some of the techniques or cases in the U.S. because these are very unique to Ukraine, and so they're able to practice these techniques in Ukraine and learn. And the same for nursing as well. I think there's a lot of cross collaboration there. And we also provide support to the hospitals with materials. So we provide them with items that they may not necessarily have, but we work with the nurses, the doctors, to see what they really need in order to not only execute some of these more complex missions, but also to maybe improve the patient comfort. So I think there's a lot of work that we've been doing with that. And I think that's been really a nice touch to the co-pilot program. So I'm just going to keep it short because I know we're running out of time, but that is co-pilot. Yeah.
Thank you so much. Thank you so much, everyone. All your projects are so impressive, and we can talk about them endlessly, but we have only 10 minutes left. So I had second question pretty broad, but I will narrow down just to one short question. As you look ahead, what do you see as the next opportunity for your organization and for Ukrainian healthcare? What would you do? I don't know who would like to start.
That's a question for the audience. We have too many experts here who can definitely answer that question.
If I may go. Oh,
Go ahead.
I think what I see for us as organizations is really coordinating our efforts with each other. And this is essentially what the goal of this conference was about. That's what we saw exactly a year ago at my global conference. We had all of the organizations that are working together in Ukrainian, they're working in Ukrainian healthcare space, and we saw a huge disconnect. Nobody really coordinates, talks to each other. We reinvent the wheel. So this is what the goal of bringing everybody to Harvard was, so we can coordinate better, we can talk to each other, we can make connections. And when there is an expertise, like for GMKA, right? So our expertise is clinical education, is really bringing experts to Ukraine. We're not experts in logistics, so that's why we're going to partner. If there is a need, we're going to partner with other organizations like Nova, like Razom, to close that gap. And I think we have to all work together better in finding these gaps and closing them together so we can provide better care for Ukraine and also use our resources smarter, because I think all of us will agree that funding that we saw 3 years ago is not the same as what we see today. And then also another thing that I wanted to bring up, we also have to advocate for Ukraine, but then also teach our philanthropic donors, teach them and help them understand Ukraine better, because, you know, the rule of medicine is do not hurt. And sometimes our donors think that they know what's best, what's needed for Ukraine, but that might not be the case. And that's where we as organizations, we have to teach them and use them, and not use them, but bring whatever it is that's best for Ukraine and for the future of Ukraine. Thank you.
And I'll continue with the same theme. I think this is super important, and it was great to hear from Vasil and Ministry of Health in Ukraine about their priorities and coordinate with our colleagues in Ukraine as well. So we talk about coordination, and that what Olga just said, it's super important. Is first, this is the first, hopefully, of this series. I know it's a lot of work to make this conference happen, but I think this is super important for us to continue this communication on different platforms. One of them could be in-person conference, some other platforms that we can come up with, continue coordination here in the US, internationally, but super important to have that coordination with Ukrainian partners, learn from them. We've heard a lot from our American doctors who they're doing incredible work in Ukraine, but we also know a lot of Ukrainian doctors who are really innovative. They push the limits. They do a lot in Ukraine, and this exchange of knowledge that needs to happen with data analysis, data collection analysis, knowledge exchange, and what all collectively it will help is to help a lot of the systems in Ukraine, health systems, to get to the next level. We've heard about prosthetics today, we've heard about mental health, we've heard about other things, and increasing capacity building, sharing the knowledge, and getting that knowledge so we can build robust, adaptable system that can really provide support that's needed to Ukrainian people. I think that's the future.
Thank you. Alex? I will break the
Yes,
order.
yes.
I would like to actually add on that, and I think communicating what we're doing, to your point, Ola, like being able to tell our stories better is also really important, something that we've been working on over the last few years, but it's always a work in progress, and I think being able to tell a story will hopefully inspire others to maybe support us even more, not just within this room, but beyond, and find new partners, and I think that's also going to be important, yeah.
Thank you. Katarina?
Yeah, I just agree with everything that was said. I would probably add one thing that today and I'm sure tomorrow we'll hear about so many different gaps and problems in Ukraine, in healthcare, in medical system, and we all understand that projects become more complex because they cover. It's not only a medical problem. We've heard that several times today. It's also a social problem. So I think what would be great to continue, because we already started to do that, but probably we need to be more focused on that, is like to think strategically and to think how we can collaborate and partner and communicate not only within medical infrastructure, but also with social services, with veterans affairs, with education and all of that stuff. So, and we definitely need to be more strategic. It's clear, and I know in Nova Ukraine, especially during like board's meeting, when we say, hey guys, how we will look like in 5 or 10 years? That's a tough question because the problem and the need is still there and the war is still there. A lot of people have been traumatized and injured every day. And this is so difficult to think how we will look in like 5 years. But I think this is exactly the point when we need to ask ourselves, especially as a nonprofit, as medical establishments, as businesses probably, what we can do to rebuild Ukraine in the future. And we need to be ready for that already today. Mm-hmm. And the third point, like to wrap up, what we see for these almost 4 years of the war, that for changes to become reality, to be implemented, it takes time and consistency, especially in medical sphere, especially in healthcare system. So yes, it's difficult to see some results. It's so difficult, especially in medical projects, to show donors some quick impact. But I think that we need to be resistant and we need to understand that it takes time, consistency, efforts, collaboration. Thank you.
Thank you. Taras?
Yeah, well, the quick answer, obviously agree with all you guys. How could I not agree with you guys? Education, helping each other with all our experience so we don't do the same mistakes again. Mm-hmm. Using the partners that we have already found. We had some partners probably that we are no longer using. And for you guys not to use them because sometimes those partners are the first to show up and raise their hand or connect with you. And cooperation, not only with a lot of it's Ukrainian American organizations, but we need to incorporate other organizations and a lot of their international experiences. One thing that we also lack, I don't know, I could really say about us, marketing. You get some groups that are marketing great. They're shipping 3 boxes and they got super Facebooks and websites, and we're going, geez, we sent containers and nobody knows about us, And whatever these models that we're going to be using or doing, it has to be win-win. We can't just keep on giving them fish. We have to teach them how to fish. And the groups that are the American organizations or doctors, the trauma surgeon experience, the American government should be like, I'm sure China is in Russia right now looking at the medical experience, the drone experience, and America's still sitting like this trying to decide, how we're going to do that. So we need to market this knowledge that's sitting in Ukraine right now. And that makes it a win-win situation.
That's amazing. Thank you. I hope that today's discussion will inspire for new dialogue, because when we talk, the new ideas come out and new decisions we can find all together. And we had an idea tomorrow
10:30.
At 10:30 in the morning. Please check your schedule, because we will find an auditorium when we will be happy to meet any of you and talk about any opportunities, possible new collaborations, what we can do together. So please continue to support. Thank you, everyone.